Hello everyone, myself Shivangi Patel. I am from 4th year BPT. Today I was going to speak about the mastectomy and its management. So what is mastectomy? Mastectomy is a surgical procedure to remove one or both breasts, partially or completely, usually as a treatment for the breast cancer. Now, goals for the physiotherapy post-mastectomy: to reduce pain and swelling, to prevent shoulder stiffness and frozen shoulder, to improve upper limb range of motion, to prevent lymphedema, to restore the posture and strength, to improve respiratory function after anesthesia or chest wall involvement, encourage emotional and psychological recovery. Phases of physiotherapy management. First phase is immediate post-operative phase that will come between the day 1 to day 7. Goals are to control the pain, to prevent the respiratory complications, to maintain circulation and posture, and to educate the patient. Interventions. Breathing exercises will give diaphragmatic breathing, deep breathing. For circulatory exercises, will give ankle pumps, hand and wrist movements. For posture education, will avoid slouching using pillow for arm support. Gentle range of motion exercises for elbow, wrist and hand active range of motion. For pain relief, we will give ice packs and tents if needed. In education, we will educate the patient about the arm positioning, drain care and precautions. Now, second one is the early recovery phase that will come between the first to 4 weeks. The goals are to improve the shoulder mobility, to reduce stiffness and swelling, to begin functional movements. Interventions. Shoulder range of motion exercises, that is wand exercises, wall climbing, pendulum exercises, postural correction, shoulder blade pinches. For scar management, once heals, will give gentle massage to prevent adhesions. To prevent lymphedema, will elevate the arm, gentle lymphatic drainage techniques. For pain control, we will continue with the gall therapy or TENS as needed. Third phase is the strengthening phase, which will come between the 4 to 8 weeks. The goals are to strengthen the upper limb and postural muscles, to improve the endurance, to continue the scar mobility and lymphedema prevention. Interventions. Isometric exercises for the shoulder and scapular muscles, resistant band exercises with low resistance. Functional training, lifting light objects, reaching overhead, and in aerobic activity will give walking, stationary bike. For stress management, will give relaxation and breathing techniques. Fourth one is the long-term phase that will come after the 8 weeks. The goals are to return to normal daily and recreational activities, for full shoulder function and strength, and to prevent long-term complications. Interventions are progressive strengthening, postural retraining, aerobic conditioning, 30 minutes, 5 repetitions per week recommended. Return to work or daily activity training. For psychological support, we'll give group therapy, body image counseling. Now, coming to the precautions. We'll avoid the heavy lifting objects on the affected sites in early on stage. Watch for the signs of lymphedema like swelling, heaviness, tightness. Avoid blood pressure, IVs or injections on the operated arm. Don't overstretch or force shoulder movements in the early stages. Thank you.